Melinda Haynes, license number 102308. So what do we do when we don't know what to do? So you're chilling with your client. You've got this client, things are going along really well, and then all of a sudden there's this awkward dead silence. And you as the new therapist, you're like, oh no, what happened? I'm losing them. They're not making progress. I need to say something. I need to do something. And it gets kind of panicky almost. And then you've got all this pressure to like perform therapy. And that can feel anxiety provoking. So what we need to do in those moments, in those awkward moments of silence, is to acknowledge that, not out loud to the client necessarily, but just within you, is that this is about me. This awkward silence is about me, because a lot can happen in the silence. A lot can be happening with the client. Just the fact that they're sitting in a safe room and they're sitting with the person who's listening and attentive and who cares, that in itself can be powerful. The fact that you're not trying to force them to keep talking, to force them to keep processing, to keep doing something, making progress, that you're just allowing them to be where they are in the moment. That fact, all of that is sometimes just enough. However, if you feel like, it's been a long time now, maybe they're crying, maybe they're just very silent, and you feel like it's time therapeutically to move forward, you can say some things that might be beneficial. You can say something like, I notice your body tensing up right there. Tell me about that. Or you can say something like, think out loud for me. What's going on? What's going on for you right now? Think out loud. Or you might even be able to say, I notice your tears. Tell me what those tears mean. Tell me what those tears are saying. And then whatever it is that you say, be silent again. Just let them answer now. Let them think about it. They might need a few minutes to actually think about what you've said, process what you've said, and then try to form the words to describe what it is that they're feeling. And they may not want to answer you at all, and you need to be okay with that. Okay, so just the fact that you're there, you're staying present, you're not running away from the silence, you're not trying to just fix the problem and make yourself feel better about yourself or about being a therapist. You're just allowing them to be wherever they are in the moment. And you're using those questions as a tool to kind of move forward if maybe they're stuck and they just don't know how to come out of their silence. Okay, so anyways, becoming a therapist, it's a fun and exciting experience. I appreciate you guys for choosing this profession. It's pretty awesome. So if you have any questions, please contact me. Thank you for watching.